I was going to ask you if you could give us a story or an anecdote.
Well, I could tell you that I have so many of them. One of them is that patients actually come in and don't tell you why they're really there. There are many times I found lumps in women's breasts, and I said, do you know there's a lump in your breast? And they'll say, yeah, I knew, but I figured if you didn't find it, then there was nothing wrong. Then there's the story about Benny, who was a bookie, and Benny came from the Bronx, and Benny came in, he had a sore throat, and I took care of it, and as I was leaving the room, Benny says, hey doc, how come I got pain in my chest this morning moving the garbage? So I went back in, and of course Benny was having a heart attack, but he didn't tell me that's why he was there. So we did a cardiogram, sent him off to the hospital, and later that night I go in to visit him, and he's surrounded by all these guys without any necks, and they're all leaning over the bed, and he's probably going over the daily bookings that he just had. And in the old days, we used to have these little heart monitors that were kept in a cloth and attached to the patient. And I said to the guys, I said, you shouldn't be careful with what you're saying. That's a tape recorder. And all of a sudden, they all started jumping out. You know, what's only kidding. So a little humor is good. So that's something that people don't say. And of course, one has to be a trained listener to what people do say. And one also has to use every sense that they have, including the sense of smell.
Sense of smell, how does that play into it?
Well, when I was training in Italy, they made us smell every patient that came in, not because of body odor, but every disease has a smell. If you have kidney disease, you have a smell. If you have liver disease. And it came to fruition one day. I was being visited by the Armenian Bishop of Jerusalem, who was a friend of mine, and he came in this office, and ordinarily he was a robust, healthy-looking guy. He was pale, and he had that terrible smell of melena. Melena is a Greek word which means black, but melena also is a term that we use for stool, that is digested blood in the stool. So he had this terrible smell of melena that nobody else kind of picked up on. So I said to him, you know, we have to do a blood test on you, and there's something else I'm going to have to do to you that's not the nicest greeting when you come to visit somebody in America. And I did a rectal, and of course he had blood in his stool. But I only knew it because I could smell that smell. So a doctor uses all of his senses, and then of course there's luck. And the next story I'd like to tell you about is the story about Ray Carino, who at about 5 o'clock on one day I was closing, and this man, Ray Carino, came in. He was breaking out with a cold sweat, and I said to the secretary, I know we're going home, but this guy's going to have to go to the hospital, call the ambulance. So I took Ray back into the room and hooked him up to the cardiogram, and just as we were doing it, he went into ventricular fibrillation.
Which is?
His heart started beating uncontrollably, which means those are the stages just before the heart stops. And I didn't have a defibrillator. I never needed one. I was in practice 15 years. Just then the ambulance crew came in right behind me, and I said, do you have a defibrillator? And they just had it in their hands. And we shot Ray back into Yorktown, and the ambulance crew said, you're not going to believe this, but it was donated to us 2 hours ago. Up until that time, Yorktown did not have a defibrillator in their ambulance. And 2 hours before, Ray Carino's life was saved because somebody donated this. Now, how lucky is that?
Timing, sure.
And 10 years to the day, Ray came in to thank me for saving his life. And he said, my wife is out in the car. She's been in the emergency room all night. Otherwise, she would come in and thank you, too. So I went out, and she looked terrible. I brought her in, and guess what? She was having a heart attack. So Gretel Carino, 10 years to the day, but she didn't have to be defibrillated. And so luck, and so they're part of the book, and they're very. Scotch and a bottle of port. Not port.